So what?
Just tell me everything.
Oh God.
The hospital doctor called me
Yeah,
about
there's
about
some things I started remembering after the fact. It all kind of started. Um, I was at a traffic light,
give me the
and
dates.
yesterday,
Okay.
and I kind of blinked my eyes, and suddenly I wasn't at the traffic light. There's people pounding on my window saying, hit your brakes," because I had let my foot off the brake, and it was rolling forward, and it went through the intersection, over a curb, and almost down an embankment.
Yeah.
And that got me to thinking, well, I don't really feel tired. Maybe this is, I had a concussion last month, and they said that even weeks later, sometimes symptoms can come in to where you black out or whatever.
Yeah.
It was a severe concussion. I mean, I couldn't even sit up. And
What happened during the concussion?
oh
How
God,
was it?
this was April 9th,
Okay.
and I was on an e-bike and I fell at about 25, 28 miles an hour. Hit
No.
here, and
You hit your right side of your head.
do what? Yeah. And even if I just like barely touched here, the shooting pain would come here.
Yes.
Felt like I was swimming.
Okay.
I had to go back. They wanted people to check in on me, which they did. And someone came in to my apartment 3 days later and said, "You got to go back. Something's wrong." So I went back to the hospital. And then that's when they said that, it could take a long time to recover. And that even after you do start recovering, you could have something come back. So that's what I thought happened at the intersection.
Okay.
So I'm like, well, do I need to go to the ER? And I don't know. And my son couldn't take me. He said, well, just call an ambulance so they could at least check you out.
Yeah.
The ambulance came and they're like, no, you're going to the hospital. And we're putting on the sirens and the lights and we're taking you straight to CT.
Okay.
Now, after the fact, I'm remembering that I've been forgetting stuff the last 24 hours.
Yeah.
Like stuff someone says, and then like a minute later, I'm forgetting. I'm having trouble at a lot of the times talking. I'm having to really push to make the words. And then something else that's been happening is I'll just kind of phase out. I thought it was just me being sleepy, but that's not it. I can feel my eyes roll back, and then I come back, and I actually had whoever was before you was talk to my pastor, because I was nodding out during his sermon at church.
Yeah.
And I was sitting front row, like right in front of him, and they said, well, they asked him, well, what did you see when this happened? And he thought I was just been up too late the night before, which I wasn't. And he said that I would nod off, and then I would come like this when I opened my eyes. And I had gotten up in front of the congregation to play violin. And when I got done, I fell to my knees. But I thought that was just the Holy Spirit.
Yeah.
No, that's not the Holy Spirit. This was some other crap going on that I looked at now. And I'm very weak. I mean, I usually do yoga. I'm usually able to pick my legs up to here and stretch, and it's hard. It's harder to lift this leg. Moving from the bed to the CT,
Yeah.
that was hard. And I'm like,
When did you notice that?
today. This is all today, and yesterday, or what is? Well, yes, yesterday. The traffic light thing happened around 5 o'clock. Some of these signs, I realized they started happening around 10 in the morning yesterday, and I'd been forgetting stuff since the day before that. But I just thought that was my ADD or something. But it's all, when I look back at it now, I'm like, there's a clear pattern of me starting to forget stuff. Nodding off and stuff.
Okay.
But the thing that freaked me is at that intersection. Normally, if I'm tired and I'm not off at the wheel, it's like this.
Yeah.
That had to be long enough for the truck to, because you take your foot off the brake, to slowly go through the intersection, for people to stop their cars, come chase me, and knock. That was a long ass time. That was several seconds.
Yeah.
I don't remember a damn thing of it. I don't have any sense of that, and that's new. Yeah, and they say the CT shows a little aneurysm, but the MRI says no stroke.
No stroke. Yeah, the aneurysm. It is not related to this. It's an incidental finding. I think I'll come back to this. Okay.
Okay.
I think you were incidental means. I think you're probably born with it, and I think it's
You think I probably what?
born with it, born like you born like
Oh,
yeah, and it has no relationship. to
born
the-
with falling asleep.
no the aneurysm.
Oh, born with the aneurysm.
Yeah, so it's not. It's unrelated to this something else, right?
Huh.
Yeah, it's something we can
I've had an aneurysm my whole life. Maybe
maybe, and if
that
you,
might explain a lot.
no, yeah, if you, I mean, aneurysm is concerning. A lot of people have aneurysm, right? But it depends on the size. Yours was 2.6 millimeters. When it's over 10 millimeter, then that's when they start surveying it and watching it. But
So
Would that-
make sure I hear you. So if it gets to 10 millimeters, that's when it's concerning.
yes,
And
that's
mine's
when
only
it's concerning.
2.6
2.6.
and may have been sitting there for years.
Yeah.
So maybe you could just not even worry about trying to do surgery or
No,
anything.
no, the one I'm not even thinking about surgery. If
Oh.
if I want you to see the
No
surgeons-
catheters going up and trying to
nothing,
obliterate.
no, nothing. If I wanted to,
Woohoo!
yeah, if I wanted to see the surgeons, it's just for completeness sake. Like,
Right.
okay, see them. Since we found something,
Okay.
this is in your own field of practice. Just that's what we do. Right?
Okay.
But
So
nobody.
this other stuff could be concussion related, maybe?
This is concussion related, I think.
Just coming back and
Yeah.
nipping at me.
Yeah, no surgeon is going to go after that kind of aneurysm.
So there's not much that can be done other than just rest.
Okay, but tell me about that.
Well, and then the
that head
stroke
trauma-
type stuff. They say my face was drooping and I'm slurring my speech. That still could be concussion.
No, but that's what I want to come to. Like when you had the injury, the accident when you felt the concussion like a month ago, did you pass out?
No.
Okay, you just
Mind you, I had a severe concussion 2 years prior.
okay. Tell me about that.
Actually, how far back do you want to go about? I've had concussions many my whole life, but the most recent two, in 2022, late December, it was 14 degrees, and there was a water leak on the road from the fire hydrant, and my truck got stuck in it. And I got out to try to assess the situation, and my feet went out from under me, and the first thing that hit was the back of my head. And my son said I literally cracked 2 inches of ice. There was this thick thing of ice. I go to JPS, and this eye's all twitching and 2 days later I go back because I just didn't feel right at all, and my eye was getting blurry. Well, over time got over that. It took a few months. Then this last one, and mind you, there's a dent in my head right here from when I was 8, and I bashed my head into a pole on a swing set. I've been dropped on my head. I was on an accident on a bicycle when I was in 2nd grade, fell forward so bad. I was supposed to have plastic surgery. I mean, if I didn't have plastic surgery, I'd be like this. And this was when I was 3. I fell on a can of applesauce and paralyzed this whole side of my face. It was like this. That's why I got this extra dimple to the nerve damage.
Yeah.
So I've been having concussions, and then this last 2 were pretty bad. This last one was freaky. I've never been able where I couldn't just sit up, and I was feeling really, really, really just weird, like something's really wrong all up in here. And that's what started to feel like again yesterday after the incident at the traffic light. That's one reason I definitely called to see about coming in, because I'm like, and it feels weird, not as weird as a month ago, but it's getting weirder. So my head kind of feels swimmy and gushy, and I don't know how to describe it, but I am forgetting stuff. I stumbled through trying to spell my name earlier, and just things are a little off. I know things are going to be okay. I'm not getting down about it, but I'm just analyzing it. There's something off.
Do you have any headache right now?
It's not a hurt. It's just real kind of tight on the surface and just
There's nothing there. This is what
feels
Who did you give
liquidy inside, and I don't know how to describe it. It just feels weird inside my head.
All right, but have you been having dizziness?
When?
Not this full body dizziness, but just like when I stand up, it's just like up in here. It's
Yeah, just like swelling, like.
like it's pulsing, like it's like a swirly pool of water,
Oh, I see. Okay,
swirly.
what you're saying, yeah.
Yeah.
All right, but right now, do you have any numbness, any tingling, nausea, vomiting?
I don't have any nausea.
Let me examine
And
you.
again, it's like just now, just doing all this talking is exhausting. It's
Squeeze.
exhausting to me.
Squeeze hard. Okay. Hold this up. This one. You can put your hands down. So kick against me. I'm testing your strength. Kick. Okay. Can you hold this leg up?
See, that's what's weird. I can hardly do that.
This one. Up. Okay. Okay. Any back pain?
Oh yeah, yeah. I've got back pain.
Okay. Is it new?
No,
Okay.
I mean some of it happened after
This-
falling off the bike.
This feels the same.
This feels stronger over
Right,
here.
feels stronger.
than- yeah,
What about this?
same thing. I mean, I feel it over here, but it's just not as much.
Stronger. Can you close your eyes? Let me test your face. What about now, sir?
They're close to the same, just ever so slightly less on here, but it's very close.
Touch my finger. Touch your nose. Okay. Right hand. Left hand, sorry. Touch your nose. Alright, do this for me. Use your right heel and scratch your left shin.
Do this.
Yeah. Switch. Sorry.
Oh God, see, that shouldn't be difficult to do.
Okay.
And see, that hurts my lower back too. doing that.
Okay, when you lift your right, your left, hold, look up. Okay. Give me a big smile. Big smile. I think the dimple, but I don't really notice a facial.
Yeah, it's
Yeah.
looking. I saw myself in the camera. It was looking better.
Okay, look at me and just give me a white smile. Show me a teeth. All right. Yeah, there's a dimple, but I think it's. But as you, when you look at your face, did it change from previous? Because you told me you had some trauma and the facial
Right.
droop.
That's when I saw it. When they were saying I had a droopy face, I pulled up my camera and looked at it because I was telling them, said, this left side's going to look a little different.
Yeah.
But it was noticeably different
Okay, different.
this time. I don't know how it looks now, but it was definitely noticeably more
Okay.
than normal.
Than normal.
Now it may be gone now. I don't know.
Yeah, it's still there a little bit.
Yeah.
It's still there a little bit. Look at my nose. Focus here. I'm testing your peripheral vision. How many fingers do you see?
2, 1, 3, 1.
Okay. Okay, so there are a couple of things. Your symptoms. The symptoms you're having, the swollen feeling, the wavy feeling, and all that. What happened to the traffic light? It's called post-concussional syndrome.
Post-concussion syndrome?
Post-concussion syndrome, like after a concussion, right?
Right.
And usually kicks in around the third to the fourth week.
Oh, well,
Yes.
that's a.
Yes.
There it
yes,
is.
And it can affect your sleep, like just cognitive. It can affect your cognition. So the treatment for that is, it's what we call cognitive behavioral therapy.
Cognitive what therapy?
Cognitive behavioral therapy, CBT.
Okay.
And there's no medication we can give for that. But we treat the symptoms. If there's headache, we treat the headache. If there's nausea, we treat the nausea. If there's insomnia, we treat it. It's a symptomatic treatment. Then the other thing, your left leg is a little bit weaker, and when you raise it, there's pain in the back. So it tells us that it's possibly a pinched nerve at the back. So let's get an MRI of the lower back or the lower
Okay.
spine. Then we'll have physical therapy work
Well,
with
I've
you.
got pain in my whole back since the accident.
Okay, yeah. Okay, let's get MRI of the back.
Thank you.
Then
And does that include this? I hurt this whole area here on my shoulder.
I want to start with the lower back.
Okay.
Yeah.
Or the-
Then,
but it does hurt all the way up the back. Anyways, go
Yeah.
ahead.
Then the left facial droop and the decreased sensation on the left side. That's a stroke-like symptom. That's a stroke symptom. But the MRI of your brain was fine.
I had a stroke symptom here before, and at that time, they did. I don't know, it was MRI. They were looking at my neck to see if there was any plaque built up and all this stuff.
Yeah.
And it was kind of funny because it took them hours and hours, and they came in and said, "We're sorry, we had to send the results to New York because we couldn't believe the findings." there's usually X amount of plaque in everybody. There was none. They said we couldn't find any, so we thought the readings were off. So you didn't have a stroke. I went to the chiropractor and it was a pinched nerve right back here.
Yeah, I know.
And that took care of it.
And that's a curve it. Okay.
Yeah.
And
So that could be that again, or who knows?
no, but it wouldn't like, but the face, it wouldn't affect the. It wouldn't affect.
It would make it droop.
It wouldn't make it group.
Yeah, it just felt. I got you. I got you.
So let's leave you on a baby aspirin and a cholesterol medication that protects against stroke.
Okay.
Then for the aneurysm, like
Just have it checked once a year or something.
yeah, follow up with neurology in clinic. Yeah. Follow up with neurology in clinic, and then for they was talking about the post concoction syndrome, the love leg pain, and the treatment for stroke, and then the aneurysm. Those are the 4 things, okay? But enlarge yourself. Then okay, I shouldn't forget this. Please don't drive until you're cleared by a physician.
Okay.
Yeah.
And how do we get cleared by a physician?
Now when you see in the clinic and you think like, can I drive now? In the state of Texas, if a person has a seizure, you're required not to drive until you're seizure free for 3 months. If you have syncope, like passing out, that is unexplained, you're required to wait for 6 months before you go to the road. But I think yours may be explained by the post concussion syndrome. That's why I want you to follow up with a neurologist or whichever doctor sees you first, and then bless you that you can drive.
Okay.
Please.
So they'll assess.
Yeah, they'll assess you and do that. Okay.
Okay. You're not issuing an order to remove my license,
No,
but
no,
you're
no.
saying to respect your
Respect, yeah,
wishes.
yeah.
I can do that.
Yeah. No, by state law.
I can do that, sir, for sure.
Yeah.
Yeah.
Yeah. So.
I don't want to drive. I don't want to do that shit
Yeah.
again.
No, by state law, we are not recommended to report, but we are recommended to advise.
Okay.
Yeah, so I'm not gonna talk to the TMB and like, oh, this guy, no, we don't do that. But I'm telling you that, do that, okay? All right, but I think in whole, your symptoms, the head waviness, the memory issues, and all that, you need part of the cognitive behavioral therapy deals with all of that. So that's what's really going to take you out of this. But that is from the concussion.
That makes total sense. You know, it's funny because I was saying to someone yesterday, I was like, a lot of this seems like concussion stuff. Discovering the aneurysm may have nothing to do with concussion at all. It's just a coincidence. That,
It's a similar, it's just a coincidence.
and you know, so on the post-concussion syndrome, what is the therapy called? I'm not getting that one.
CBT, cognitive behavioral therapy. CBT.
What is that B word? I'm not.
Behavioral,
Behavioral?
like behavior.
Behavior, okay. Behavior. So there's going to be like a, not physical therapy, but
Yes, physical, but mostly like cognitive, mental, like, yeah.
you know, so I'll come in to do that, or how does that work?
Oh, I think the neurology clinic here should have it. If they don't have
Okay.
it, but yes.
But it's an actual thing where you have an appointment and you have therapy.
Exactly, yes. It's either by psychiatrist or psychotherapist or
Got you.
psychologist.
Okay.
Yes, yeah. So that's what you need. Yeah, I've had.
Whatever you got to do.
Yes, I've had people who came back from war with post concussions, and then they have to do that. Yeah, so it's something we see a lot after concussion.
So post-concussion behavioral therapy, CBT. Okay.
Yeah, CBT.
Now,
It's cognitive behavioral cognition. Cognitive behavioral
Right.
therapy.
Well, I already have. See, I had chronic fatigue immune dysfunction syndrome, like the one caused by the virus, which is when I have a relapse, it's very, very, very similar to long COVID. And there's cognitive issues with that as
What
it
virus
is.
is that?
Chronic fatigue immune dysfunction syndrome is the condition.
Yeah.
And my original doctor said, and if you go online, there are many who feel that certain people with that is caused by a retrovirus.
Yeah.
When I got COVID and got long COVID, and I was like, no, this is exactly like a relapse with chronic fatigue syndrome.
Yeah.
And with that, there is a decreased, I've been told, there's a decreased blood flow to the temporal lobe of the brain that happens. So I'm already have cognitive issues that I deal with already on a normal basis. When I have a relapse, it's bad. When I'm not in a relapse, I can manage it. It's frustrating at times because my IQ is 147, and then when you can't add 2 and 2 because of this crap. So I can see what you're saying with the concussion thing, cognitive, in a different way. I'm analyzing myself because I want to be the best me as possible. So if I heard you correct, aneurysm, born with, maybe check on it once a year, talk to the neurologist.
Yeah.
Take it off the table.
Yeah.
Now today, 3 to 4 weeks after a concussion, which is right about now, you can start having post-concussion syndrome, for which the only treatments are treat the symptoms and do some therapy. Otherwise, I'm going to guess a lot of rest.
Yeah.
Do I need someone at least checking in on me a few times a day? Because I'm usually by myself at my apartment. I've got an apartment complex where I can leave the front door open and people will check on me.
I think that would be good. Yeah.
Okay.
Yeah.
Do you think it's serious enough to where I should go stay with someone and just there in person? No, the fact you're thinking about it tells me that it might not be a bad idea.
Yeah, no, I think you should, because if that happened at the traffic light, right?
It could happen anytime.
What if you were cooking and you burned the house?
That might not be good.
Yeah, that's what. Yeah, it might not be good. So yeah, because it was a long time. Yeah.
Some people are okay burning their houses. Me, not so much.
Yeah.
You can tell I approach life with a sense of humor. I'm not taken away from the seriousness. Now, are they wanting? How long would I need to be in the hospital? Where all else needs to be done?
Have they done the echocardiogram of your heart? I think that's the next one.
I think they came on with
the machine. Yeah, yes. But I want us to look at the back.
Oh yeah.
Let's do the back. Yeah, let's do that.
Did that happen today or?
Yeah, it happened today. Oh wait, today's Memorial Day, but I'll put in the order now.
Okay.
Yeah,
So it may not happen till tomorrow.
Yeah, it may not
I
happen.
may not go home till Wednesday.
Yes, that's a chance.
Okay.
That's a chance.
Just asking. Hey,
I
got
appreciate
it.
your sense of humor.
Oh, you ready for this?
Yes.
What do you call a medical student what do you call a med student? What do you call a med student that drops out of school? A dentist. If you laugh at that, you're an anti-dentite. You racist, you. Nah, made the neurologist laugh. I
Thank
have
you, sir.
achieved success.
It was a good encounter.
It was a good encounter. Thank you.
All right.